Okay, so first we got to choose our disease, and then after we talked about our disease that we picked with our group members and searched up facts.
And then we collaborated on it to make a visual.
Later on, we started doing the critical friends. That's when
we performed that in front of different groups.
That's when another group basically reviews you, and then they give you back the feedback.
And whoever gets the highest vote out of the groups gets to present in the theater.
And it's going to be very exciting.
Currently, there is no cure for an E. coli bacteria infection, and that is due to most E. coli bacteria are not harmful. Jason said, there's a common type called Shiga, which is very harmful to the human body. There's also no vaccines, and the only thing that we can do to prevent getting E. coli is by cooking our meat well, making sure our milk is processed, and cleaning our hands after touching animals and touching animals. Sorry.
So diagnosis, there's not much to it. One way to look for signs of the E. coli virus is by a flu. Bloody or mucousy stool samples lasting 5 to 10 days is a common side effect to it. Doctors will take a sample to the lab in order to check for the bacteria. And for treatments, there are no current treatments that can help the virus right now, but at home you can stay up to your hydration level and get some rest. Hemolytic uremic syndrome is a stronger form of the E. coli virus affecting younger kids and the elderly. This syndrome is kidney failure, and frequent hospital visits, IV fluids, blood transfusions, and kidney dialysis will hopefully help. This was our presentation on E. coli. Thank you for watching.
Fantastic job, E. coli, and now we're going to transition to smallpox disease.
Hello, so today we're going to be presenting smallpox to you. My name's Sarah, this is Vanessa, this is Johanna, and this is Nicole. So imagine it is the 1950s, you have a widespread rash, severe headache, backache, abdominal pain, vomiting, and fluid-filled pustules covering every inch of your body. Well, you have contracted smallpox. So today we're going to be talking to you about smallpox, how it originated, how it affected us, and how we eradicated the disease. So first off, let me start by telling you what smallpox is. Smallpox was an acute infectious disease, usually caused by the variola virus, usually followed by fever and fluid-filled pustules that later turn into, or lesions that later turn into pustules. So there were two varieties of the virus, variola major and variola minor. Variola major being the more severe, deadly, and common form of the disease. There are a few nicknames for the disease like the red plague or pox. So smallpox can appear in 4 different forms, first being the ordinary form, which comes along with the lesions and rash. Then is the modified form, which is similar to the ordinary form, but the progression of scabs comes quicker. Then we have the flat form, which is when the lesions are soft and velvety, which don't reach the pustular stage. And then the last form is the hemorrhagic form, which appears with skin petechiae, which is like red, round pinpoints, and are the result of bleeding. So moving on, smallpox can be diagnosed by isolating the virus from the blood or lesions, or by identifying the antibodies made in response to the virus. Smallpox can be diagnosed in specialized laboratories using appropriate testing techniques and measures to help protect the laboratory workers.
Okay, so the reason that smallpox was such a big issue at the time was because it was very contagious and it was very painful for those that had it. So anyone and everyone was susceptible to smallpox, so literally anyone in this room could have smallpox, could get smallpox regardless of age, race, gender, no matter what. So the virus would infect the bloodstream and then move to like your lungs, your intestines, your kidney, like all of your organs. It spreads similarly to like present-day diseases, so bodily fluids like saliva, from like coughing, sneezing, even talking. But the most common way that it was spread was through the air. So if you were like talking to someone for a good amount of time, direct like face-to-face interactions, you could get smallpox. But it was also spread through like bedding and clothing. So those that were ill, the doctors that and nurses that took care of them were more likely to get it because they were like around them more often. In the 1950s, there was 15 million cases of smallpox, and in 30% of those cases, there was death. The most common symptom that you probably know about is the bumps all over your body, they were very painful and they could be filled with like pus and stuff. But other symptoms are like fever, headache, backache, abdominal pain, vomiting, and diarrhea. So overall, it's just a very horrible virus that can just, it's very painful.
So there is no cure for smallpox. However, there are a few ways to prevent it, and the most effective way to prevent it was to simply stay away from anybody who had the disease to prevent infection through contact. Another way to prevent it was to get vaccinated, and people could have gotten the vaccine before coming in contact with the virus. In the event that they did get sick, they wouldn't be, In the event that they did get sick, they wouldn't be as sick compared to if they didn't get vaccinated at all. The vaccine contained the vaccinia virus, which was a pox virus similar to smallpox, but less harmful. The vaccine allowed the body to develop an immunity to smallpox. In other words, if the body was attacked by the virus, the body would be able to fight it off. The vaccine lasted up to 3 to 5 years, and after that, its ability to protect the person from the virus would decrease. There were treatments for smallpox. However, the treatments were mainly focused towards relieving symptoms and keeping the body from becoming dehydrated, and there is no treatment proven to be fully effective in those who are sick with the virus or with the disease. Their vaccine is no longer available to the public because in 1980, the World Health Organization declared that smallpox was eliminated, and therefore the public did not need protection from it.
So in talking about the last known cases of smallpox, the last known case for someone to naturally get the disease was in 1975. A 3-year-old girl in Bangladesh had contracted the disease naturally, so as a result, she had to be quarantined up to 24 hours a day, and the smallpox organization took that very seriously, so they even had guards posting up at her house 24 hours a day, and as a result, within a 5-mile radius between her house and healers, churches, playgrounds, meeting areas, they were contacted by the smallpox organization just so they could prevent a breakout. And the smallpox organization even offered rewards to anybody that could come up with symptoms or any known cases, just so they could prevent it. When talking about someone dying of smallpox, it was in 1978 with a girl named Janet Parker. She was a college student in England, and she had contracted the disease either airborne or physical contact, but it wasn't confirmed. But she had started off with a rash, and when she went to the doctors, 9 days later, she had been diagnosed with smallpox. Unfortunately, a month later, she had passed away from it. Her mom, who was taking care of her at the time, had actually contracted smallpox later on, but because her mom had the vaccine, she didn't actually pass away from it, so she lived her life. When talking about smallpox affecting history, it took a major effect in Europe because the Europeans were actually going on expeditions, and they were going and spreading their diseases and then coming back with more, and that's why the royal family, with Queen Elizabeth, they were affected by smallpox a lot. Talking about the U.S., supposedly Abraham Lincoln had smallpox, but he actually didn't die from it because he died from other causes. You guys know that story. And then that's basically what smallpox has affected the U.S., but you can think about how smallpox would affect everyone in this room, or when you guys are walking into anatomy, you guys shake Miss Freed's hand, that's a physical contact. So everybody after that would have contracted it. So that's our presentation.
Great job, smallpox, and now we're going to transition to the seasonal flu.
And I am here with Autumn and Audrey, and today we are presenting to you the seasonal flu. Imagine it is 1983 and 49,000 people have just died due to the seasonal flu. You may be thinking this is unimportant and immaterial because it happened in the past. However, what you might not know is that just last year in 2018, this virus almost doubled entirely. Today, we are presenting to you the knowledge and information you may need to know in order to bring awareness to this issue. We will be educating you on the causes, effects, symptoms, and how to prevent the once was deadly disease. To start off, you will not understand the importance of the effects of the disease without knowing what it is or how it is caused. So the seasonal flu, or better known as influenza, is an acute respiratory infection that is caused by influenza viruses. It is contagious throughout the entire world, and it can infect your nose, throat, and sometimes your lungs. It may cause a mild to severe illness and may lead to death if the virus triggers a severe inflammation, causing a rapid respiratory failure in your lungs, meaning that your lungs will not be able to provide enough oxygen into the rest of your lungs. Some symptoms of the seasonal flu may include coughing, sneezing, sore throat, fatigue, headache, and many more painful symptoms. The way that this is spread is quickly between people when one sick or contaminated person coughs or sneezes, sneezing dispersing the droplets of the virus into the air. Another way that this is spread is by hand contamination, so be mindful of the people you may be high-fiving in the hallways.
Today I'll be talking to you about how seasonal flu affects the cells, how it spreads, and who is at risk. So back then, we didn't have the resources that we're lucky enough to have today to diagnose people with seasonal flu. Now we use the Rapid Influenza Diagnostics Test, which is the most common way of testing worldwide. It checks for antigen substances from the back of your nose or the back of your throat using a swab testing thing. It spreads very easily if someone is as close as 6 feet away from you. If they cough, sneeze, or even if they're just talking, like Zaina said, a droplet of their virus can enter from you inhaling, and it can attack your nose, throat, or lungs. The virus contains genetic material that connects with your cell membrane, and it is like a key to a lock. It travels to the nucleus, and the virus's material hijacks the nucleus's material. It creates a new virus, goes through a packaging process, and then you have the flu, and you should definitely take a sick day. The people that are mostly at risk of getting influenza are people over the age of 65, especially if they're living in a facility or convalescent home, because germs spread very easily there, and that's why you always see hand sanitizer in a hospital. Also, pregnant women and babies, mostly under the age of 2, are very prone to getting seasonal flu, so that's why they should always be protected. But what it comes down to is that anyone is prone to getting seasonal flu, so you should always be cautious.
So yes, as Autumn stated, everyone is at risk for the seasonal flu. However, if you make yourself and others a priority, you can lower that risk by such a great amount if you follow through with some simple but also very specific preventions. Experts all around the world recommend that the #1 best way to prevent being infected with the seasonal flu is to be vaccinated every year. However, there are some people who are not comfortable with following through with those medical procedures. And to those, we say that there are certain daily decisions that can ultimately lead to habits, which are washing your hands more often, washing your face, or even not touching your face as often. Not taking care of your overall hygiene can affect your immune system in the long run and could lead to something as severe as being diagnosed with the seasonal flu if you don't take care of that. As important as it is to take care of the outside of our body, we need to recognize the bacteria of our surroundings and everything we come in contact with. We also need to recognize the significance of what we are putting inside our body as well. Take somebody, for example, who is eating healthy and working out consistently, maybe not as strict as our New Year's resolutions, but somebody who does that compared to somebody who isn't has a much less chance of being infected with the seasonal flu. However, we can do everything we can to prevent getting sick, and we all know that majority of people in this room have had the flu at one point in their life. So when you do have the flu, you have to be treated, and there's certain medications you could take. They are antiviral drugs such as oseltamivir, perimivir, and zanamivir. These 3 specific antiviral drugs can help you recover much quicker than if you don't take them. However, you have to take them within the first 2 days of you recognizing the symptoms. As Zena said earlier, you could feel nauseous, have a headache, or have a fever. With all this knowledge and information that Zaina, Autumn, and I have thrown at you guys comes responsibility. We want to invite you guys to help us spread awareness of this disease, not only by taking action to the information we have given you, but by doing so, you can not only benefit yourself, but others. As Zaina said, in 2018, there was such a large population that was infected with the seasonal flu, and we want to move forward with history, not backwards. So please follow through with these preventions and recognize the education that we need on the seasonal flu. And by doing so, we can all live happier and healthier lives. Thank you.
Fantastic job, seasonal flu. Now we're going to transition to the HIV virus.
All right, so today we'll be presenting HIV, and my name's Isaac. This is Caesar, and this is Ryan. So in 1959, scientists discovered the first case of HIV from a male blood sample originating from the Belgian Congo. Nearly 6 decades later, HIV is now is now a global pandemic affecting millions of people around the world. And so what is HIV and why is this such a big issue around the world today? Well, HIV is a human immunodeficiency virus that attacks the immune system, and it does so by attaching and fusing itself with your body's T helper cells, which basically help fight off infection. And through a process called reverse transcription, the virus pretty much replicates itself inside of the cell, and it can then leaves the cell and continues to infect other cells throughout your immune system. And so why is it so dangerous? HIV is such a dangerous virus because it infects the immune system, and once you reach a certain point, your immune system becomes so weak to the point where your body can't fight off simple, normal infections that you fight every single day. And the symptoms of HIV are very normal at the beginning. So when you first contract HIV, you have flu-like symptoms for the first couple months and even years. But as years go by, you'll experience more concerning symptoms that'll make you want to go to the doctor. And by that point, the virus is will have damaged the immune system so much to the point where you can't do anything about it. And once HIV infects the immune system and the immune system is too weak, it then turns into AIDS, where your immune system can't fight back anymore.
All right, guys, so I'll be talking about prevention and transmission. So how it works is that when a person has HIV, and basically when it spreads to another person, it's called HIV transmission. So how it works is that HIV only spreads by body fluids, which is basically blood, pre-seminal fluids, the rectal fluids, the vaginal fluids, and also when women are breastfeeding. So how does HIV attack the system? HIV attacks the CD4 T cells in the immune system. So basically, if HIV attacks those T cells, your body works harder to go and try to fight off any other diseases, viruses, and also cancer cells. And basically, if HIV is not treated, at the end, HIV transmits into AIDS. So basically, at the end, AIDS is the worst part in the body, and that's basically chaos, which you do not want, because you don't want HIV to transverse into AIDS. So basically, at the end, going back into HIV transmission, is HIV only comes from body fluids, damaged tissue, and also the blood. So for example, the mucous membrane. The mucous membrane is the mouth, such as saliva, and also other private areas in the body. Also, an example is that the US, so how it works is that HIV only comes from unsafe sex and also drug injection equipment such as needles. So basically, if I wanted to get tattooed right now and I saw a needle that was already been used, there's a possibility that me getting into a virus, it may not be HIV, but at the end, the needle has been used and the person might have HIV or any other sickness in the body, and I might get it. So which again, you have to be safe. You have to make sure that, okay, this needle has to be clean and everything has to be ready, good to go. So going back to also into women. So when women are pregnant at the end, and when the woman has HIV, and when you're pregnant, you are giving a higher risk to the baby because again, body fluids, the damaged tissue in the body, and again, the woman has HIV, and you're giving the baby into HIV. So it works is that when women are breastfeeding, women should not ever breastfeed their child, because at the end, you're giving your blood into the baby, and at the end, your doctor may say, hey, your baby's born, but again, you have HIV in the system, and that's why, again, if you are a woman, you have HIV, you must get it treated, because at the end, you do not want your child or your kid to have HIV in the future, and you know, it could be a chaos at the end. So how does this prevent? So the biggest thing that I have 2 words for you guys is that be safe, because again, people who have couples, people who are married, people who have boyfriends/girlfriends, at the end, you have to be safe for yourself, because again, it's not hard to ask your partner to say, hey, are you safe? Have you had your shots before? Are you healthy? Because again, you do not want to put yourself in any other infections, diseases, because, and the reason why I say this is because, again, you're safe, you know, you have all your shots, you're healthy, but again, your partner is the one that has, you know, it may not be HIV, any other diseases, cancers. So again, you're the one that has to be preventable on yourself. So again, don't forget, be safe. And also, HIV, there's no cure. So again, you do not want to have HIV go into the AIDS, because again, you don't want to have the chaos into the body.
So how to diagnose HIV? It's really simple. You can take these 2 tests, the blood test and the saliva test. These 2 tests consist of finding the HIV antibodies that were produced in the DNA. To treat the HIV virus, patients will go to the Antiretroviral Therapy, which is known as ART. Taking this therapy will have the patient take 3 or more drugs. These because they need to take 3 or more drugs. If they take the minimum of 2, the HIV virus can still replicate later on. These drugs consist of the NRTIs and the NNRTIs, which prevents the HIV virus RNA from replicating into the DNA. The IPs, where blocks the HIV virus proteins from replicating too. The early inhibitors blocks the HIV virus from getting into the targeted cell, and the integrase inhibitors, which blocks the HIV integrase protein from getting to your cell genetic material. So how does these drugs help is they improve your CD4 T cells by helping the immune system. So the average person that is affected by the HIV virus has 200 CD4 T cells per microliter, but the average person that did not get infected by the HIV has 1,000 CD4 T cell per microliter. These drugs help reproduce CD4 T cells, and while taking these tests, it can come out negative. You should always take it again, because HIV can be also undetectable. And that's it. Thank you.
Great job, HIV. And also thank you everybody for coming and learn this period and learning a bit more about E. coli, smallpox, or E. coli, smallpox, seasonal flu, and HIV. I hope all of you enjoyed this and learned something new. Please join us next period as we talk about tuberculosis, the dengue fever, Spanish influenza, and the seasonal flu. And don't forget to have an amazing day. Thank you, everybody.